that should take the edge off.
It's less painful than the last few times.
Glad to hear it. I've increased the dosage of lipoic acid. Sorry to say you may experience some increased side effects. It's not a cure, but should keep it at bay for a while.
I've been looking into studies from the Institute of Radiology in Prague based on treatment protocols in Chernobyl.
Apples and oranges, Jack. We're not talking about alpha particles and beta particles, gamma or neutron rays. The radiation you were exposed to when you walked into that reactor, well, it's a different fruit altogether.
Then we'll keep looking.
20 years I've known you. You're not one iota less stubborn. How's Sydney?
She's doing well.
I remember when she was just starting school. Where do the years go? Jack, I've watched countless people die. Had to look into my patients' eyes when I tell them what they have is terminal. And you know what? That stuff about laughter being the best medicine, it's a load of bunk.
I assume you have a point.
A clean conscience. That's a treatment I can stand behind. We both know how this is going to end. We can filter your blood till the cows come home, but there's no changing the outcome. Clear your conscience, Jack.
That would take another lifetime at least.
I'm not suggesting you write your memoirs, although I'm sure they would make a hell of a read. Start small. Talk to your daughter.
She's better off not knowing.
Jack, these secrets you're keeping, they're not yours to keep. Decades of research went into the development of this little marvel, and you yank it out with a letter opener.
What are you talking about?
You don't have the faintest... I implanted it to regulate the medication in your bloodstream. I explained the entire procedure to you.
You did?
I did.
I have no memory of this.
Well, we talked about the fact that memory loss could be a side effect. I even implanted a second one in your calf. You don't remember that either, do you?
My position, my job, this side effect is unacceptable.
I can adjust the medication. But your condition is progressing quicker than I had anticipated. Jack, have you thought any more about what we discussed? About Sydney?
Sydney has had to face so many things in her life. Too many for someone so young. And now, given my condition, I don't want to burden her. It's not fair.
Honesty. That's fair. You won't always be around to protect her, Jack. She has to know the truth before it's too late. I'm afraid our options are limited, Jack. The white blood cell anomalies are not what we'd hoped for.
Limited, not exhausted.
Well, science is full of happy accidents. Alexander Fleming spent years trying to figure out how to treat bacterial infection. He needed a vacation so bad he forgot to wash his Petri dishes before leaving the lab. So he comes back a week later, well-rested, tanned, and what's he faced with? A stack of moldy dishes. But he looks a little closer, and son of a gun, not an iota of bacteria growing anywhere near the mold. Penicillin. Just a happy accident.
Fascinating anecdote, although its relevance to my condition isn't exactly...
I've spent most of my career researching genetic mutations, mostly in rats. I like rats, much smarter than they're given credit for. These little buggers were exposed to the mother lode of radiation. I was distracted one day, problems with the wife, and I accidentally gave them a lethal dose of an alkylating agent. But lo and behold, a few of my rats survived. Milo lived to the ripe old age of 4.
That's something.
Yes, but 84% of my rats were dead within a week. And given what they went through, death was a blessing.
We both know the prognosis for my condition. I don't see that I have a choice.
This alkylating agent was discontinued decades ago. It was considered too lethal, even in controlled environments.
I have contacts. I'm sure I can procure the necessary chemicals.
Here's what we need. Jack, as one friend to another, these drugs are nasty. If they don't cure you...
I'll turn out like one of your rats. I'll be in touch.
How'd it go? All right. I'll prepare this and we'll be ready to go. Connie will take care of your personal belongings.
How are you feeling today, Mr. Bristow?
Hopeful.
Everything's set? The whole procedure should take about 4 hours.
What are these restraints for?
Some patients go into convulsions when they're unconscious. I wouldn't want you to hurt yourself. Jack, have you thought about talking to Sydney?
I do keep too many secrets. When this is behind me, that's going to change. Sydney deserves more. She deserves to know that she's the most important thing in my life. She and Laura, of course.
I'm proud of you, Jack.
If for some reason this doesn't work, tell my girls I love them. Sydney and Laura.
You're gonna pull through this, Jack. I'll see you on the other side. I'd like you to count backwards from 10.
10, 9, 8, 7.
Atticus, so good of you to come.
After what Jack did for me,
Sydney will show you the infirmary if there's anything you need.
I'd like to see my patient.
Right this way. Dad. Dad. My friend is here to see you.
Hello, Jack.
Am I cured?
Not yet. But I'm going to make you better.